These are various community support groups from Harare's Eastern District. They are part of the Zimbabwe National Network of People Living with HIV, ZNNP+. They are constituted mainly by people living positively with the human immunodeficiency virus, HIV. These community support groups play a pivotal role in the HIV response as they are part of the awareness campaigns that involve community-based education aimed at positive health, dignity and prevention. The Positive Health, Dignity and Prevention PHDP is an HIV response program that places people living with HIV at the center of the HIV response and advocacy.
Ndora toda kushandisa mukati mezivara nhasi saka zvinoitwa pakondomu ngatisaisawo makondomu edu muhomwe kunyanya vana baba muback pocket kana kusanganisa kondomu redu nemakisi zvinoitika kuti kondomu redu ritsemukire nechepamwe pacho robuda mweya saka chekutanga kana uchisanganizana uchipiwa kondomu rako chekutanga unobata kondomu rako wonzwa kuti rine mweya kana waona kuti kondomu rako rine mweya wotenderedza kuseri kwacho wotarisa expiry date wogutsikana une mazuva acho kuti date riri kuseri kwacho harisati rasvika hauzofanira kushandisawo kondomu redate rakafura kare kare.
Ndakanga ndiri munhu ari kungorarama ndiri ndega pasina kudisclose status ndikudhara kwakusati vanhu vakawanda vasati vazikanwa kunzi vane utachiwana ndikabata zvirwere zvese zvemwoyo ndikatomboita cardiac arrest inove heart attack iyai zvaindinetsa kurarama ndiri ndega asi pandakazojoinawo masupport group muna 2011 zvakandibatsira chaizvo nekuti ndakaona hama dzangu dzekurukukurirawo zvichemo zvangu zvinenge zvichiita sei zvichinetsa takabva ndakudzidziswawo kuti kana mapiritsiwo tikwanise kuwawanawo.
The ZNNP+, an organization that advocates and lobbies for the rights of people living with HIV through information dissemination and networking, is spearheading training programs aimed at capacitating people living with HIV to be able to play a key role in the HIV response.
Positive Health, Dignity and Prevention seeks to empower people living with HIV to be at the center of the HIV response. We're talking of the 90-90-90 UNAIDS global targets. We are talking of ending AIDS by 2030, but all that can only be achieved if people living with HIV are at the center of programming.
The Positive Health, Dignity and Prevention program is in line with Zimbabwe National AIDS Strategic Plan Guiding Principle number 11, which clearly states that people living with HIV and AIDS have to be on the forefront in planning, implementing and evaluating activities that are that relate to themselves.
PHDP came in handy because it's a broad aspect of the stigma reduction. As people living with HIV and AIDS, we suffer some kind of stigma in different ways. This includes self-stigma and the stigma that we face in the communities that we live. And as ambassadors for PHDP, I think the program has come in handy because we first of all address the stigma issues as ourselves as people living with HIV and AIDS instead of depending on other people to do that for us. So it's indeed a very, very good program for people living with HIV and AIDS.
A meaningful involvement of people living with HIV is the one that started where a group of HIV positive persons started this process of saying nothing for us without us. They were being discriminated because then the HIV and AIDS was taken to be a disease for either gay people or people of low morals. And people were being just taken as recipients of services. Then when people living with HIV came together, then they said, no, we want to be meaningfully involved in the process. Then out of that, that's when the PHDP was actually born.
Chirongwa chinodzidzisa zvikurukuru takatarisana nenyaya discrimination, takatarisana nenyaya dzekupa vana vachiri vadiki vasati vakwanisa mazero ekuroorwa chirongwa chandinoti isusu chinopa kudzivirira zvikuru HIV and AIDS. Takatarisana nedinginira ririko kuti ngativharei mukana wekuunza zvirwere zvitsva munyika.
I think this is a very critical program whereby we are trying to uphold the dignity of human beings or of people living with HIV and AIDS in respect of their status. We are saying a human being. The virus does not make you less human being or less competent. If you have got your profession, if you have got your skills, you can still parade your skill and market it. So we are saying, we are trying to say to those people who are HIV positive, let's not be so much stigmatized or discriminated, and let's avoid that buy into those wrong sentiments, because you are a human being. Your skill is a skill. You need to market it and display it accordingly, and live as a human being who is loved, respected by God.
The Positive Health, Dignity and Prevention Program, as spearheaded by the ZNNP Plus, has been identified as a step in the right direction, and stakeholders urged the donor community to avail more funds to strengthen the scope of the program.